Alzheimer's, welcome to another mini lesson. In this video, we're going to talk about disorders of the brain and cranial nerves. Before we begin, let's differentiate between a few terms. Cognition refers to the process of acquiring knowledge through thinking, learning, and memory, and the adjective form of the word is cognitive. So the term cognitive refers to pertaining to the mental activities of thinking and learning. The word confusion is used to describe a mental state in which stimulus is not processed appropriately or accurately. It's the inability to process information normally. And we're going to differentiate between delirium and dementia. So let's start with dementia. Dementia is a collection of signs and symptoms with many different causes. Symptoms can include short-term memory loss, inability to solve problems, confusion, inappropriate behavior, and impaired intellectual functioning. Delirium is an acute, altered state of consciousness and can include agitation, disorientation, and most of the time it's reversible. It can also be caused by dementia or stroke. So some people get delirium and dementia confused, but they're really two different processes. Alzheimer's disease is the most common form of dementia, and this is a condition in which nerve cells in the brain are replaced by clumps of protein. And vascular dementia occurs when the arteries supplying the brain with oxygen become narrowed or blocked. Okay, let's move on to strokes. The medical term for stroke is cerebrovascular accident, or CVA. And this occurs when blood supply to part of the brain is suddenly interrupted, and the cells are deprived of oxygen. The cells may die or become badly damaged. There are two types of strokes. Ischemic strokes may be caused by atherosclerosis, which occurs when plaques form in the walls of a cerebral artery, or an embolism where a blood clot travels from somewhere else in the body and lodges in a cerebral artery. Or the third type is microangiopathy, where there's a blockage of very small cerebral arteries. These are all types of ischemic strokes. The term ischemia means lack of blood supply to a tissue. The second type of stroke is a hemorrhagic stroke, and these are sometimes called intracranial hemorrhages. This occurs when a blood vessel in the brain ruptures, and this could be due to a cerebral aneurysm or something called an arteriovenous malformation, or AVM. Disability after a stroke can be mild or severe, and the effects depend on the location of the stroke. In our previous video, we talked about the functions of each individual lobe, so depending on where the stroke occurs, that will determine what the person's disability is. A common disability is paralysis on one side of the body, called hemiplegia. If the person has only weakness rather than complete paralysis, this is referred to as hemiparesis. Problems understanding speech or forming words, controlling emotion or judgment may also persist after a stroke. You may have also heard the term mini-stroke. The medical term for this is transient ischemic attack, or TIA. This type of stroke usually results in short-term, milder symptoms that last for less than 24 hours. Patients who suffer multiple TIAs are at risk for full-blown stroke and other complications. The next disorder is cerebral palsy, or CP. I'm going to read you the CDC definition of cerebral palsy because I think it's a bit more comprehensive than what's in your book. Cerebral palsy, or CP, is a group of disorders that affect a person's ability to move and maintain balance or posture. CP is the most common motor disability in childhood. Cerebral means having to do with the brain. Palsy means weakness or problems with using muscles. CP is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. Causes can be congenital, maternal drug use, or due to an incident that caused hypoxia at birth. So generally, the classifications and effects of CP can be applied to other disorders like stroke and spinal cord injuries. And the classifications are listed there. And treatment of CP usually includes physical therapy, speech therapy. If their muscles are very tight, what we call spastic CP, they can use muscle relaxant drugs, and mechanical aids may be needed like braces or wheelchairs. We classify CP based on the number of limbs involved. Diplegia refers to both arms and sometimes legs. Monoplegia involves only one limb, usually an arm. Paraplegia involves both legs. Quadriplegia involves all 4 limbs. And triplegia involves 3 limbs. The classifications of any movement disorder, but we're talking about cerebral palsy, so we'll apply it to cerebral palsy here. But the classifications of movement disorders are spastic, athetoid, or ataxic. So a lot of times in CP, they'll use the term spastic, which just means tight muscles that are resistant to stretching. So the muscles become very tight because they're overactive and they produce rigid, tight, spastic movements. Athetoid refers to involuntary writhing movements and constant motion. This term isn't used a whole lot anymore. Generally, we use the term dyskinesia. Remember, dys means bad or abnormal, and kinesia refers to movement. Ataxic is a term we use for a staggering or unsteady movement or walk due to a poor sense of balance and depth perception. So when we describe a type of cerebral palsy or a type of CP the person has, we combine the classification of movement disorder and the number of limbs involved. So, for example, we would say someone has spastic quadriplegia or spastic diplegia or spastic triplegia, something like that. Okay, moving on, now let's look at epilepsy. Epilepsy is also known as seizure disorder. In epilepsy, clusters of neurons discharge or fire electrical signal in abnormal rhythms. Basically, the brain is sending random electrical signals and misfiring. Epilepsy can be caused by abnormal brain development or brain damage and can cause a loss of consciousness and convulsions. There's 2 classifications of seizures, partial and generalized. Partial seizures are when abnormal activity is only in one area of the brain. For example, one limb may jerk or have abnormal movements. Generalized seizures can be absence seizures, tonic-clonic seizures, or febrile seizures. Absence seizures used to be called petit mal seizures. These are more commonly seen in children but may continue through adulthood. In this type of seizure, it usually looks like someone is staring off into space and daydreaming, kind of like they're out of touch. They generally recover quickly and need no intervention. Tonic-clonic seizures used to be called grand mal seizures, and this is what we typically think of as seizures, and they can be very dramatic. In this type of seizure, the person experiences a loss of consciousness, which is abbreviated LOC. Their muscles stiffens, their jaw clenches, which can last for 30 to 60 seconds. That's the tonic stage. The clonic stage follows, which is when the whole body shakes with violent rhythmic jerking motions. The seizure can last for 1 to 3 minutes before consciousness returns. And febrile seizures are usually seen in infants and kids up to about 5 years old, and they're caused by very high fevers. And febrile seizures are not linked to epilepsy later in life. If a seizure does not end after 10 minutes or more, or reoccurs 3 or more times without the person gaining consciousness, we define that as status epilepticus. This is a medical emergency because the risk of hypoxia and damage from persistent seizure activity. And we need to treat that right away. So status epilepticus is treated with administration of IV drugs to stop the seizures, and we need to make sure that that person's airway is protected. After a seizure, there's a period of decreased awareness, sort of like a foggy mental state. This is a temporary condition. It's called a post-ictal state. Tourette syndrome and other tic disorders are characterized by episodes of involuntary, rapid, repetitive, fixed movements of individual muscle groups. A tic is simply the name for the repetitive, short, sudden movements. Tourette's is a syndrome that combines motor tics, which are simply movements, and vocal tics, which are noises. And vocal tics are usually something as simple as throat clearing or coughing or grunting. Of course, everyone assumes that people with Tourette's always blurt out obscenities, and that's simply not true. Tourette's is defined as motor tics combined with vocal tics. Only severe forms of Tourette's combine the shouting of obscenities. Narcolepsy is a chronic disorder which is caused by the brain's inability to regulate its sleep-wake cycle. A person with narcolepsy falls asleep during the day for a few minutes up to a few hours with a loss of muscle tone, which is called cataplexy, and brief episodes of total paralysis and sometimes even hallucinations. Okay, some more brain disorders here. Parkinson's disease is caused by a degeneration of the neurons that produce dopamine. It results in tremors of the hands, rigidity, a shuffling gait, a weak voice. The characteristic shuffling gait is called a festinating gait, or more commonly a Parkinsonian gait, where the person leans forward, takes a few small shuffling steps as if they're hurrying, and then they don't swing their arms. The person will also appear to move very slowly or hypokinetic. Huntington's disease is also known as Huntington's chorea. It's an inherited disorder that involves personality changes, jerking, and irregular movements called chorea, which is Latin for dancing, and muscle weakness, and then eventually dementia. Syncope is a common medical term. This is simply the medical term for fainting or passing out. It's a temporary loss of consciousness. There's a condition called naturally mediated syncope, or NMS, that's associated with cardiac arrhythmias and other diseases that can cause syncope. Cerebral edema is excess accumulation of fluid in or around the brain. Cerebral edema can be associated with trauma, tumors, inflammation, toxins, ischemia, and other conditions, and this is a very serious condition. Brain tumors are often the result of metastasis from cancers in the lung, brain, skin, or kidney. They're treated with a combination of surgery, radiotherapy, chemotherapy, or brachytherapy. Headaches are classified into 3 types: vascular, muscular, and inflammatory. The medical term for headache is cephalalgia. Remember, algia means pain and cephalo means head. There are migraine headaches that can be very intense and produce an aura, or tension-type headaches, which are generally muscular, and cluster headaches that occur in a series over a period of time. Headaches are usually treated by treating the underlying cause and reducing symptoms. Brain abscess is usually the result of an infection from sinusitis, otitis media, which is an ear infection, or mastoiditis. Remember, an abscess is just a big pocket of pus or infection. So all these conditions are in areas that are very close to the brain, and if the infection is bad enough, they can form abscesses in the brain. Creutzfeldt-Jakob disease is a rapid deterioration of mental function and difficulty in coordinating muscle movements. It is related to mad cow disease, which is bovine spongiform encephalopathy, or BSE. The damage to the brain is thought to be caused by an infectious protein called a prion. And if you know anything about prions, they are crazy scary because they are not actually living organisms and they can basically survive anything. So Creutzfeldt-Jakob disease is a very scary disease because there's basically no cure and there's basically no effective treatment. The treatment is to alleviate symptoms. The focus, it causes personality changes, memory loss. Most people lapse into a coma. There's basically no effective treatment, and they try to alleviate pain and relieve symptoms, and it is incurable. It's an awful disease. Encephalitis is the last one on the list, and this is inflammation of the brain tissue, which is viral in nature. Usually you see encephalitis in children, the elderly, and patients with compromised immune systems. Okay. This slide talks about traumatic brain injury, or TBI, which affects over 1 million people each year. Injury to the brain usually results from trauma to the head and can result in permanent disability, which affects a person's ability to work and perform what we call activities of daily living, or ADLs. Contusion is just a bruise. It refers to a bruised area of the brain, just like you would bruise any other part of the body. Concussion is a mild head injury. Symptoms may include feelings of being dazed, a period of confusion, loss of consciousness, and loss of mental ability. These symptoms may last a few minutes, a few days, or even a few weeks. Repeated concussions have a cumulative effect, which we have seen in football players and in most severe cases, traumatically induced Parkinson's disease, like in Muhammad Ali. In a coup contra coup injury, this is a type of concussion that occurs when the brain is basically bounced around inside the skull. You generally see this in motor vehicle accidents or in sudden deceleration accidents when the brain is first bruised at the site of impact and then injured again on the side opposite the impact. Shaken baby syndrome occurs when a baby is violently shaken. Because babies have weak neck muscles and a heavy head, they are unable to resist the forces of shaking. The shaking movement makes the brain bounce back and forth in the skull like a coup contra coup injury and leads to severe brain damage. Shaken baby syndrome can also result in retinal hemorrhage, spinal cord injury, and fractures, and usually occurs in children younger than 2 years of age. The terminology we use to describe the residual effects of brain damage includes impairment, disability, and handicap. Impairment refers to a deviation from normal function. Your book gives the example of not being able to control an unwanted muscle movement. That would be described as an impairment. Disability is a restriction in the ability to perform a normal activity of daily living. For example, not being able to perform ADLs or being able to walk independently. Handicap is defined as having a disability that prevents a person from achieving a normal role in society that's consistent with their age and sociocultural setting. Your book gives the example of a 16-year-old who cannot take care of their own toileting and hygiene. That would be consistent with the definition of a handicap. So those were disorders of the brain. Now let's take a look at some disorders of meninges. A hematoma, remember, is a collection of blood. So a subdural hematoma is a collection of blood or bleeding into the subdural space, which was the space below the dura mater. These are usually caused by closed head injuries, blows to the head, or ruptured blood vessels. And the bleeding must be stopped surgically and the blood drained. Epidural hematomas occur when blood accumulates in the epidural space outside the brain between the blood and the skull. These are usually associated with skull fractures and bleeding from an artery in the meninges. The few times I've seen these in the ER, it's been when somebody was struck on the side of the head with a baseball bat or something similar like a pipe. And again, this requires immediate surgical intervention. Meningitis is inflammation of the meninges, and there's two types, either bacterial or viral. Viral is the most common form and can occur at any age. Bacterial meningitis is more common in the very young or very old patients. Meningococcal meningitis, which is a bacterial form, is highly contagious and has a high fatality rate, and it's associated with living in areas that are highly populated, like college dormitories. In fact, most states require college students to be vaccinated for meningococcal meningitis before they attend college if they're going to be living in dormitories. Vaccines are available to prevent most forms of bacterial meningitis. Meningioma is a tumor that originates in the arachnoid layer of the meninges. Remember, oma means tumor, and these are generally benign and slow-growing and can be removed surgically. Now let's move on to some disorders of cranial nerves. Probably the most common disorder is Bell's palsy. Just to note, your book has it written without the apostrophe S, just Bell palsy. I don't know if that's significant, but I've only ever seen it written as Bell's palsy, named for the doctor who identified the syndrome. Anyway, this is a disorder of the 7th cranial nerve 7, which is the facial nerve, and palsy means paralysis. So Bell's palsy results in hemifacial paralysis, or paralysis on one side of the face. Inability to smile, whistle, grimace, drooping on one side of the face, inability to close the eye on that side, and as you can see in the picture, the person is smiling, but they're unable to control the muscles on the affected side of the face. This condition is temporary and usually resolves in 6 to 8 weeks on its own with no intervention, or in some cases, it may be permanent. It's generally caused by a virus or inflammation. Trigeminal neuralgia is also called tic douloureux. It is a disorder of the 5th cranial nerve. This condition causes intermittent, stabbing, severe pain in the area that's supplied by the 5th cranial nerve. According to the Harvard Medical School Health publication, I'm going to read you what they wrote. Patients describe the pain as sharp, stabbing, piercing, burning, like lightning, or like an electrical shock. In most cases, only one side of the face is affected. The pain of trigeminal neuralgia is recognized as one of the most excruciating forms of pain known. The pain often is triggered by non-painful facial movements or stimuli like talking, eating, washing the face, brushing the teeth, shaving, or touching the face lightly. In some cases, even a gentle breeze on the cheek is enough to trigger an attack. The attacks generally last only a minute or two but can recur in random episodes or clusters. Treatments include medications, stereotactic radiosurgery, and microvascular decompression. That sounds awful. And then the last one on the list is Horner syndrome. This occurs when there's damage to the sympathetic nerve pathway from the brain to the face on one side of the body. And this can be caused by trauma, stroke, tumor, or an unknown cause. Like Bell's palsy, symptoms are seen on one side of the face or unilateral and include eyelid drooping, decreased pupil size, and decreased sweating on the affected side of the face. There's no specific treatment for Horner syndrome, but you can treat the underlying cause. Okay, that's it for disorders for now. Let's look at some word analysis and abbreviations. On the right, we have the terms hemiparesis and hemiplegia. The prefix hemi means half. Paresis means weakness, so hemiparesis means weakness on one side of the body, either the right half or the left half. Plege means paralysis, so hemiplegia is the condition of being paralyzed on either the right half or the left half. AVM was the abbreviation for arteriovenous malformation. CVA was cerebrovascular accident, and TIA was transient ischemic attack. Here, these terms were related to muscle tone and seizures. Atonic, clonic, and tonic. In atonic, A means without, tone means tension or pressure, and ic means pertaining to. So atonic means without normal muscle tone. Clonic, clon means violent action from a Greek word meaning turmoil. Ic means pertaining to. So we use this term to describe the seizure activity where there's the rapid succession of muscular contraction and relaxation. And tonic, tone means tension or pressure, and ic means pertaining to. So tonic means a state of continuous or sustained muscular contraction. The abbreviations on the right side, BSE was bovine spongiform encephalopathy. That was the term for mad cow disease. CJD was Creutzfeldt-Jakob disease. NMS was neurally mediated syncope. TB was thrown in there for tuberculosis. That was one of the conditions they threw in there to cause an infection somewhere in the textbook. ADLs, that was activities of daily living. SBS is the abbreviation for shaken baby syndrome. And TBI stands for traumatic brain injury. I would also add to that list CP for cerebral palsy. Okay, friends, I think that's it for this video. The next video will cover part 2 of disorders of the nervous system, and we'll discuss disorders of the spinal cord and peripheral nerves. Thanks as always for your attention, and I will see you in the next video. Thanks!